sa inyong lahat. Welcome sa ating 32nd Kapihang OH online edition. This is a monthly session where we tackle the latest updates in the field of occupational safety and health. We hope that everyone is safe and healthy. Kami po dito sa Philippine College of Occupational Medicine, Quezon City Chapter ay nagagalak na paunlakan niyo po kami uli ng inyong oras para makinig at matuto sa discussions natin ngayong gabi. Welcome back to our Kapihang OH. Ako po ang inyong host, Dr. Jason Jan Cabigon, ang Chair ng Finance Committee ng PCOM QCC. Ngayong gabi ay tatalakayin natin ang tungkol sa isa sa mainit na topic. COVID-19 strikes back, the rise of the Delta and Lambda Variants. To welcome us all sa ating 32nd Kapihang OH, ladies and gentlemen, our PCOM Quezon City Chapter President, Dr. Catherine Artalis Carriaga.
Maraming salamat, Dr. Cabigon. Magandang gabi po sa inyong lahat na aming tagapanood at tagapagsubaybay mula sa iba't ibang panig ng Pilipinas at sa labas ng bansa. Sa aming kapamilya sa Philippine College of Occupational Medicine, mga kapuso sa Occupational Safety and Health at kapatid sa kalusugan, isang mainit na pagtanggap mula po sa amin dito na bumubuo ng PCOM Quezon City Chapter. Parang kailan lang ang COVID-19 ay dumapo sa bansa. Isang pandemya naglukmok sa ekonomiya at iba't ibang sektor ng lipunan. Kung susumahin, mahigit na sa 1 taon na tayo nakikipagbaka sa karimlan. Ngunit bago pa man tuluyang makabangon sa pagkakadapa, dulot nito ay siya naman pagsulpot na iba't ibang variants ng COVID-19 na mas mapanganib. Maraming buhay nang nalagas, dala ng mapanganib na sakit na ito. Bagamat may bakuna na, patuloy pa din ang pagtaas ng naitatalang kaso araw-araw. Kaya patuloy ang pagpapatupad ng mahigpit na restriksyon sa iba't ibang panig ng bansa. Ngunit tuloy pa din ang buhay at pakikipaglaban. Sa pag-asang balang araw, masusugpo at mapagtagumpayan natin ang pakikipagbaka sa COVID-19. Kaya po ngayong gabi sa ating virtual na pagtitipon-tipon, kami ay lubos na nalulugod dahil kasama po natin ang isa na namang eksperto sa larangan na ito sa ating 32nd Kapihang OH para talakayin ng COVID-19 strikes back, the rise of the Delta and the Lambda Variants. Tara po, tayo ay sabay-sabay na makinig at matuto ngayong gabi. Maraming salamat po at isang mapagpalang gabi po sa inyong lahat.
Thank you, Dr. Carriaga. Our dearest colleagues, and to all our beloved guests from all sectors of the workforce, we are very honored at napaunlakan tayo ng ating panauhing pandangal ngayong gabi. Our speaker for tonight is a past president of the Philippine Society for Microbiology and Infectious Diseases. He is a member of the Medscape Steering Committee on Global Pneumococcal Disease Education. He is the chairman of Adult Infectious Diseases and Tropical Medicine Section of San Lazaro Hospital, a clinical faculty of UERM-MC, a fellow of the Philippine College of Physicians and PCMID, and a member of various DOH, DOST, and FDA committees that tackle COVID-19 and other relevant infectious diseases. Ladies and gentlemen, let us all welcome Dr. Rontgene M. Solante.
Thank you, Jason. Okay, I'd just like to share my slides at this point. Okay, so can you see my slide?
Yes, Doc, we can see it po.
Okay, so first of all, thank you again for this invitation. So it's an honor to be invited with this big, prestigious clinical organization, which is PCOM, and sharing with you some of the important information now with the vaccines. I think this is something that we really need to know. Okay, I'll start first with the variants of concern. And just to give us a better understanding why we have these mutations. So it's a normal adaptive immunity or capacity or behavior of viruses to mutate. And this is driven by the fact that the virus cannot multiply outside of the body. So meaning they need a host. And in that host, every host has the capability to really eradicate the virus. But there are certain hosts that somehow, because of their decreased immune response, this virus will take advantage to the point that they can prolong to stay there and eventually evade immunity against the antibodies in that particular host. So they mutate. So with that mutation, they can continue to be highly transmissible, and they can also infect other person as long as that particular host is carrying that virus. So who are the carriers of these mutations when it was discovered? Mostly are the immunocompetent, the elderly. So when you have patients like this, if you will not give them the vaccine, then they will continue to transmit the infection. That's why the most important aspect of controlling transmission, controlling mutation, will be vaccine. Okay, so to the point that this advantage of mutation will make them highly transmissible, will make them more virulent. That's why you'll have more severe cases. And the more worrying factor there is that they can mutate so that they can change their makeup so that antibodies that are produced by vaccines can evade. Okay, so they can evade its activity or ability to eradicate the particular virus. And this is what's happening now. There are reduction in the ability of this vaccine based on the neutralizing antibody to eradicate some of these variants of concern. So at the moment, there are 4 variants of concern that are detected. First is the alpha, then you have the beta, or you call this the South African variant, and then you have the gamma, the Brazilian variant, and then of course the delta. Okay? So each of these has more or less the same characteristics, but 2 of these variants of concern are considered king. No, so if you have lining them up, which variant of concern is dominant, and I want to be dominant, each one of these really wants to be dominant. And at this point in time, it's the Delta variant. It has the ability to be more transmissible, 50% compared to the Alpha variant. And at the same time, it can also cause more severe disease so that you'll have higher risk of hospitalization. Being more dominant, there are also mutations in the virus that they can evade immunity, particularly neutralizing activity of both vaccines. That's why when you are infected with a COVID-19 last year or early part of this year, and you will be exposed to a Delta variant, chances are you don't have any antibody to protect yourself against the Delta variant. So meaning you have a higher risk of another infection, a second infection, and can be more severe. That's how mutations, because if I'm going to give my input here, we can never eradicate COVID-19 as long as there will be mutations. So the important part here is we need to control the mutation, we need to stop the transmission, and we have the tools to do that. So currently the global distribution of vaccines of concern, Alpha variant is the most widely spread, but Delta variant is emerging. So meaning every week there is a country that reports a Delta variant. Now, how about in the Philippines? This is based on the Philippine Genomic Center surveillance. Okay, as of 3 of September, out of the 367 samples randomly selected to be tested for genomic analysis, okay, what is now the most dominant variant? Okay, so your guess is as good as mine. It's the Delta variant. So meaning, if you have 5 individuals infected with the COVID-19, more or less 3 of those individual may be carrying the Delta variant. That's the reason why it's very difficult to control at this point, because we have most of this is the main reason why cases are growing up or are very high. Okay, and if we look at our daily positivity rate, it's 26.67%, despite that knowing the reproduction value is only like 1.1. No? So this is not purely reflective of what's going on at the level of the community, because with our daily positivity rate, more testing has been done. We need more tests, and just imagine, out of this positivity rate, there are still underreported cases. Okay, there are people who are exposed, who are symptomatic, but opted to stay at home and doesn't want to be tested kasi natatakot kukunin sa LGU, ilalagay sa mga temporary treatment facility. No, so this is something that we need to look at, no? Because as long as there are people that are not tested, then the rate will continue to increase because these people will not be properly isolated. So this is a picture of your Delta variant. Okay, this is a virus. The red one here is the spike protein. Remember, your spike protein is a part of your virus that will attach to our cells. Okay, so this is the ACE2 receptor. How important this spike protein is that without this spike protein, it will never be able to attach the host cell. Now, crucial to the spike protein are the mutations. In the white ones here are the mutations that makes this virus highly fit. So, ibig sabihin, napakadali niyang makapasok sa katawan natin at mag-multiply, no? And you rarely see virus that are fit like this, no? This point in time. So, meaning this is a concern, no? Because of its ability to be fit, they can multiply, they can have more virus particles in our body. And that's why a single person carrying this virus, when you cough out, you'll be expelling out hundreds or millions of virus particles. And that's the reason why you have higher transmissibility of a single person, even in less number of transmission. Are there data to prove that? Yes. This is a data done in China, in Guangdong, during the first time that they were able to document increased cases in this region or in this city of China, driven by the Delta variant. So here, the blue one is the old variant, the original strain, and this one is the Delta variant. Okay, so this is the city value, the cycle threshold value. Just to give you an orientation, the lower the cycle threshold value, the higher is the viral load. So there, your Delta variant has a very low threshold value. So meaning you have 1, 2, 3 more log higher than the original strain in a single specimen. And in fact, in this particular data, among the 80% samples that were tested, each of the samples contained 600,000 copies of the virus in just one oropharyngeal swab. Okay, so that's how high the viral load. That's why when you look at the detection threshold for a virus that can be detected in the PCR, you have higher detection. So meaning you can easily detect because of the high viral load. So does this change something in our approach? Yes, because before, okay, when you have a patient in the earlier strain, it will take about 5 to 8 days before symptoms can appear. Okay, but with the Delta variant, you'll have early symptoms between 3 to 5 days because you have a higher viral load. That's why you have earlier symptoms to appear. The incubation period may also be shorter. In the previous strain, the incubation period from the time that you get the virus and to the time that you will have the symptom, it can be 6.3 to 13.1 days. But with the Delta variant, it has been reduced to just 5 days and 11.5 days. So meaning you have person highly infectious during the early part of the infection. So meaning, I'll just give you an example. If I'm exposed to a Delta variant patient and then I got the infection right at day 1, on day 2, day 3, I can be highly infectious, 3 to 5 days. I can have the symptoms as early as 5 days. That's how the interpretation of an earlier high viral load and at the same time shorter incubation period. Okay, so this is the comparison here, that from the exposure you'll have early appearance of your virus in the blood that can be detected in the PCR. Okay, that's why when you screen a patient and when you will require them for like a surgical procedure, the validity of the PCR has now been reduced from 7 days. It has been reduced to 5 days, and now it has been reduced to 3 days. So meaning within 3 days that patient should have a PCR. Otherwise, if you prolong that, you may not be able to catch the infectious stage of that particular patient. The other difference of this variant is that it has a very high secondary attack rate. What do you mean by secondary attack rate? The index person having the microorganism, the virus, will be able to transmit this to the next group of person that he will have interaction. That's the secondary attack. And true enough, no, this was the data, initial data in the Public Health England, 23 July. They noted that most of those that got the Delta variant are in the household compared to the Alpha variant. And that's what we're experiencing now. Ang kadalasan nakikita natin ngayon, nagkakahawaan, mga pamilya, magkakapatid, magkakamag-anak, napakataas ang hawaan. And that's mainly because these people are really prone to be exposed because they go together, they are in one room, and they are always exposed. Napakataas ng attack rate, no? So this is also another characteristic of a secondary attack. Now, I would like to segue, no, the Lambda variant. This is another variant of concern. Probably you've heard of the Mu variant. Now, I'd just like to focus on the Lambda variant. This is not yet a variant of interest, but yet not yet a variant of concern, but a variant of interest. What do you mean by variant of interest? Meaning this virus has characteristics that can be comparable to that of a variant of concern. It's just that we need more data that is really occurring and happening in the host or in the community. Okay, it's highly infectious, just like your Delta variant, and it's also resistant to antiviral immunity, including that of the vaccine. Okay, basically these are mutations that are also seen with other variants of concern that is seen now with the Lambda variant. Okay, so the event that transpired when this Lambda variant was discovered, mostly in South American countries. Okay, you have here Peru, Chile, Argentina, and Ecuador. Okay, now in the spring of 2021, last July, okay, so this was the cause of surge in Chile, suggesting that this variant is proficient in escaping antiviral immunity elicited by vaccines. Now, remember, Chile is one of those South American countries with a very high rate of vaccination, and yet they experienced surge of cases. And the reason for that is because some of those vaccinated were not able to protect themselves because of this Lambda variant. So what is this Lambda variant? In terms of infectivity, to illustrate this, it's as highly infectious as compared to your Delta. So this is your Delta percent infectivity, this is your Lambda. So meaning if this will be in the Philippines, then that can be an important problem, because just like your Delta, it can really drive more people to be getting the infection because of higher transmissibility. So we now go, how effective vaccines against these variants of concern at this point in time? Now, the Philippines approved around 8 vaccines, okay, so far, no? So we are the only country that has approved 8 vaccines, more vaccines. And this is because during the time when we are looking for vaccines, a lot of these vaccines have limited supply. So it's just but natural that the government should also look for other drug companies, pharmaceutical companies that are selling these vaccines, so that we can have more vaccines in our rollout. So all of these vaccines that were given approval through an EUA by the FDA have a very good prevention, protective efficacy against symptomatic COVID. And that's what the primary endpoints when we look at vaccines. The ability of this vaccine, that when we get this vaccine, we don't get the symptoms of COVID. The ability of blocking the transmission of COVID, ability to get the infection. Okay, so from Pfizer to AstraZeneca to CoronaVac, Sputnik, Moderna, one dose Janssen, Covaxin, and Sinopharm, all of them pass that protective efficacy. Now, the other endpoint that we look for vaccine is its ability to prevent severe disease. Okay, now the ability to prevent severe disease is not responsible. It's not because of the neutralizing antibody. We know that because the most important pathway by which we can be protected against severe disease is the ability of this vaccine to stimulate our cell-mediated immune response. Cell-mediated cytotoxic cells, that's why it kills the virus and it will prevent us from getting severe disease. And this is one reason why we need to get the vaccine, because even if we get the symptoms because of the COVID-19, our chance of not getting the more severe disease will be higher if we get these vaccines. And look at the available data, can be as high as 100%, can be 94%, 85%, and 79%. All of them are important vaccines. Nothing to really worry, no? Maski ano pang pipiliin mo dito, ma-Sinovac man yan, ma-Pfizer, ma-AstraZeneca, Moderna, or even Janssen, you are protected that you will not develop, or your chance of developing severe disease will be less with these vaccines. Now, comes the variants of concern. So I will discuss two variants of concern that is quite very high in the Philippines, the Alpha variant and the Delta variant. Ang tanong, pag pumasok ang variants of concern, alam natin na it reduces the ability of this vaccine to protect us because of the variants of concern. How impactful is it? How high is the reduction in the protection? Okay. So pag nakikita kayo ng arrow na ganyan, no, straight, sideways, then that indicates you have 10% reduction. So hindi ganun kataas ang reduction. Okay? And then there are three summary endpoints that were assessed here based on these different vaccines. No? The ability of the vaccine to protect us against severe disease caused by Alpha variant, symptomatic disease, and at the same time getting the infection. And the laboratory result that the antibody produced by these vaccines can neutralize Alpha variant. Okay, so dito makikita natin with the Alpha variant, mukhang wala tayong masyadong problema. It reduces its ability to protect us severe disease, symptomatic disease, infection, but not so significant, only like 10% reduction. Kayang-kaya pa ng mga bakuna, no? That's why the WHO said, summary of vaccine effectiveness, efficacy, despite this decrease in neutralizing antibody, decrease in reduction in vaccine effectiveness, protection is still retained against all outcome. So wala tayong problema with the Alpha variant. Dito tayo medyo may problema sa Delta variant. Okay? Kung titingnan natin to, konti pa lang tong mga data na report doon sa WHO that has a data against the Delta variants of concern. You'll have Pfizer, you'll have AstraZeneca, you have Moderna, and then yung sa Sinovac, okay, meron din dito based on a neutralization test, talagang bumababa, no? Including Astra, including Moderna. So 2 arrows down, that's 20 to 30% reduction or 5 to 10 times reduction in the neutralization. So ano ang magiging impact niyan? Can these vaccines protect us against Delta? Ang sabi ng WHO, yes, it can protect us against the infection, against symptomatic disease and infection, pero may possibility na bababa ang protection. Okay? So not anymore as high as that compared to the previous months because of the Delta variant. So ito yung concern natin ngayon. Okay? Kaya siguro naririnig nyo na may mga palatandaan na pwede tayong magpa-booster. Kailangan nito ng booster para lang ma-maintain ang protection. Ang problema, wala tayong mga bakuna, no? So that's the dilemma now. Since our main goal is vaccinate everyone, including those, especially those wala pang mga bakuna. Instead of giving the booster to someone that has been fully vaccinated, since meron ka pang protection, mas kailangan yan doon sa mga walang bakuna. And that's the value of the objective of our government, no? So we can achieve more people getting the vaccine so that we can decrease the mutation and less transmission. Kaya sana maintindihan nyo bakit sa ngayon hindi pa tayo nag-recommend ng booster. Okay? But here, with the Delta variant, protection is retained against severe disease. So maski nabawasan ang protection natin sa pagkuha ng infeksyon, no, ng COVID, pero pag nagka-COVID ka, ang chance mo na you will not develop severe disease, nandun pa rin ang protection even with the Delta variant. Okay. So ito ang sasabihin ko lang, no? Most of this vaccine gets to be evaluated by its efficacy on how it will produce and the amount of neutralizing antibody, no? Okay. Now, unang-una, ang neutralizing antibody, hindi natin ginagamit to measure efficacy and effectiveness. This is just a measure of how good your body can have or produce that antibody. Because even if your neutralizing antibody is very high, it doesn't also mean that you cannot be getting the infection. Okay? But based on this new data, no, medyo nakikita na natin ngayon na the higher the neutralizing antibody, the higher will be person protected from symptomatic infection. Okay, so merong value pala ang neutralizing antibody because it can predict that you can be protected against symptomatic infection, which is totally correct, no? Kaya kung titingnan mo dito, no, you have here the neutralization level. Okay, so ibig sabihin, pag mataas ang neutralizing antibody mo, ito yung protection mo. So sino ang nangunguna dito? Of course, yung mRNA. Then you have the Pfizer and Moderna. You have the Sputnik vaccine. Then you have the AstraZeneca. Then you have the Janssen. And then nandito sa baba ang CoronaVac, no? So ibig sabihin yung neutralization level ng CoronaVac is the lowest. Pinakamababa yan, no? And that's why you will also expect lower protection. But you still have protection because that's 50%, no? Kaysa zero. Ayaw natin yung zero. Okay? So kung titingnan natin tong arrow na to, no, this is the mean neutralization level. Okay? Pagbabasehan natin to, lahat itong mga bakuna nito sumobra sa mean neutralization level. Ibig sabihin, mataas ang neutralizing antibody. Of course, you have Pfizer, you have Novavax, you have Moderna, and then you have the Sputnik vaccine. Then you have also Astra. Medyo ang Astra kulang-kulang pa ng konti. Okay? Yung Janssen medyo nakulangan na kasi mas hindi na siya sumobra dito sa line unlike these four vaccines. Tapos ang CoronaVac ang pinaka mababa na neutralizing, which is reflected in this particular data, no? So isa yan sa mga nakikita natin. Now, the ability of vaccines to protect us against severe infection is also driven by the fact that pag mataas ang efficacy mo against symptomatic infection or mild infection, tataas at mas longer than ang protection mo against the severe infection. Okay? So meaning, if you have a vaccine that has a 95% efficacy, ito din yung ability mo that you will be protected against more severe infection, no? Okay, and this is mild. So, maski bababa pa ang protection against mild infection, normal sa mga bakuna ngayon, mataas ang protection against severe disease, no? So, tandaan natin yan, ha? Maski 50% or 60% lang yan na protection mo against the symptomatic infection na makakuha ka ng virus, but even if you get the infection, the ability of this vaccine in protecting you against severe disease, mataas, no? So, yun ang isa sa mga generalizable statement na nakikita natin. The other thing that we need to know is that since Delta is a variant that reduces neutralizing antibody in most vaccine, no? Nakita dito sa pag-aaral na to, based on actual Delta variant cases sa UK, that for those who were given the vaccine, okay, as long as they receive 2 doses, mataas pa rin ang protection against alpha and delta. So the point here is that kailangan matapos ang dalawang dose in order to maximize the efficacy of your vaccine. Kaya kung meron kayong mga nakakilala na nabakunahan tapos nagka-COVID, chances are ito yung mga partially vaccinated. Isang dose lang ang nabigay. Or pwedeng nabigay na yung dalawang dose pero it's not yet at least 2 weeks after receiving the 2 dose, no? Because wala ka pang protection. If you receive that second dose today, you still have higher vulnerability of the infection 2 weeks because it takes 2 weeks for your full dose vaccine to produce protection. Now, these vaccines are also very important in also decreasing the viral load, and that's why 2 data coming from UK that Pfizer vaccine is 88% effective in protecting us against symptomatic disease and 96% effective against hospitalization. Pag titingnan mo yung AstraZeneca, hindi rin siya nagpapahuli because they protect us, AstraZeneca protect us 93% against hospitalization. Maski mababa yung efficacy against symptomatic disease, pero dito tayo kumukuha ng value, no, in protecting us against hospitalization. Because if that vaccine protects us from hospitalization, then konti lang dapat ang pupunta sa hospital. Kaya yung sinabi kanina sa introduction, bakit mataas pa rin ang naha-hospital? It's basically because mababa pa ang vaccination rate natin, no? Mababa pa. We cannot rely on a 30-40% population. Marami pa rin ang ma-hospital despite magsasabihin natin na we are already opening up, no? Kaya kailangan nating mag-ingat. Ang importante nito, we have to wear our face mask, no? Because that's another important aspect of protection. Vaccine, the other one, then you have your face mask, the other one, then both of that, no? Dalawang protection to keep you protected against the Delta variant. Okay, so the lesson learned here is that 2 doses of both vaccines are still doing really well against the Delta variant. Okay, pero nakikita natin na talagang nagda-drop siya because of the Delta variant. Just an example, no? Nung nirelease ang Pfizer vaccine, initially, 90% siyang effective. Pero 60 days after, because of the Delta variant, 85% na lang. Tapos 90 days after, 78%. Okay? Same as the AstraZeneca, 70% against high viral load, 14 days after the second dose. But after 90 days, bumaba ng konti because of the Delta variant. So dito na pumapasok ang usapin, kailangan ba natin magpa-booster? Okay? So alam niyo na kung bakit kailangan natin magpa-booster. Now, data coming from Scotland, England, Canada, Israel are also consistent, no? Maski bumaba ang ability of the vaccine to protect us against symptomatic disease, nandito pa rin yung protection against hospitalization and death. Napaka-importanting protection yan. In Qatar, okay, they are giving mRNA vaccine. Now, nakikita nila na bumaba ang efficacy against infection, especially with the Pfizer vaccine in Qatar, 53.5% na lang. Kaya nakita natin ngayon, nagbibigay na rin sila ng 3rd dose of the mRNA vaccine. But despite that na hindi natin masyadong mataas ang protection because of the Delta variant, again, consistent ang mga data, no? Mataas pa rin ang protection against severe, critical, or fatal COVID with Pfizer, with Moderna, 89.7, 100%. Okay? So this is the table that will show you na bumaba ang vaccine efficacy against symptomatic disease pero mataas pa rin ang protection against fatal COVID-19. Sa Chile naman, ito yung Sinovac. When they were able to vaccinate 10.2 million people, no, from February to May, among 18 years, ang symptomatic COVID prevention ng Sinovac is 65.9, against hospitalization na maintain at 87.5, ICU admission is 90.3, no? So napakataas. And COVID-related death is 86.3. Doon naman sa mga 60 years old and above, ito yung mga matanda na kailangan natin protektahan. Na maintain ang protection is 66.6%. hospitalization 85.3%, ICU admission 89.2%, COVID-related death 86.5%. Now, ang tanong, after July, yung 65.9% bumaba to 58.5%. Okay? So ito yung reason that the government of Chile, because of the surge of Delta and the Lambda, nagbibigay ng third dose among those who were given initially Sinovac vaccine. No? So this was reported in Reuters August 5, 2021. Kaya magandang hintayin natin ang data ng Chile nung nagbigay sila ng third dose ng Sinovac or third dose ng mRNA vaccine doon sa mga nabigyan na ng Sinovac. Okay. This is the data that's really concerned me, no? Because this is done in Thailand from the group of this investigator working in Mahidol University. When they measured the neutralizing antibody and the receptor binding domain antibody, which are very important predictor of protection against COVID-19 among healthcare workers na nabigyan na rin ng 2 doses of CoronaVac, no? So tayo lang to, parang tayo to, no? Nabigyan ng bakuna ng Sinovac, okay? And then kinumpara nila yung antibody from those who recovered in March to May 2020 and those who recovered April to May 2021, no? Kasi pag nagka-recover ka, you also produce antibody, okay? So how did they test the antibody? Using a live virus microneutralization assay. Ano ang nagiging resulta? Okay, ito yung naging resulta, no? Those who were given corona vaccine or Sinovac with alpha, ito yung efficacy niya, neutralizing antibody, 75%. Sa beta, it's 70%. Tingnan mo naman ang delta, mas mababa, no? It's only 48.3%. So you are 50% less protected because your neutralizing antibody is really very low. Mas mataas pa ang naka-recover sa infection because the neutralizing antibody is 86.67%. Yung mga naka-recover noong 2020 at saka yung mga naka-recover ng 2021, which is newly infected, thus you expect higher antibody response. So yung neutralizing antibody nung naka-recover ng 2021, it's 93%, napakataas ng protection compared to those who were given a CoronaVac or a Sinovac whose neutralizing antibody is only 48.33%. So this is the violin graph, no? Parang violin kasi ang itsura nito, no? Dito na lang tayo mag-focus sa delta. So here they peg the threshold for detection of the antibody, which is 50 AU per ml, no? And dito nakikita natin, for those who are given Sinovac, talagang mas mababa, no? Compared to those who had a previous infection. So this is the IgG titer. So what does this implicate? This means that there is really winning immunity 6 to 8 months after receiving a Sinovac. Okay. The other good news naman, no? Sa Guangdong, China naman to, no? When they assess those fully vaccinated with Sinovac, okay, before 6 months, nakikita nila na the vaccine has a good activity also against Delta variant, wherein they look at the protection against pneumonia is 77.7%, and against severe illness, it's 100%, no? So, wala namang problema, basta bagong bakuna, mabakunahan ka, you have a very good protection. Ang question lang doon, pag tumatagal na, talagang it's something na universal sa mga bakuna, bumababa ang protection. Okay? Now, the risk of hospitalization and emergency care ng impact ng Delta variant, nakikita na ngayon, no? And this was published this August 27 na pag meron kang Delta variant, mataas ang rate ng hospitalization mo. Okay? So the adjusted hazard ratio is 2.26. Okay? That's really high. So ibig sabihin mataas na pag meron kang Delta variant, pwede kang madala sa hospital, pwede kang magka-emergency, no? And ano ang main reason? The main reason here is that kung hindi ka bakunado, mas mataas ang risk mo na pag meron kang Delta variant, mapunta ka sa hospital. Okay, and that has been observed now, in most hospitals, even in the hospitals where I'm working. 80% in nasa ICU, moderate, severe, critical are unvaccinated compared to vaccinated. That's the concern now, Kasi hanggang hindi natin matpataas ang bakunahan natin, then we will always have people who will be highly vulnerable and will develop more severe infection. So the advantage of vaccinated and unvaccinated, when you are vaccinated, even if you have the infection, you have a lower viral load. Okay? Your infection resolved faster. You have less symptom, and your symptom is also less in terms of duration. Okay? So fewer sick days in bed, and that has been proven in this particular data. Now, but because of the Delta variant, okay, unvaccinated are more prone to severe illness. Unvaccinated are more prone to transmit the infection. So remember, a single person unvaccinated carrying the Delta variant can infect as high as 5 to 8 individuals in one interaction, and even less than 15 minutes interaction. A fully vaccinated individual can still have a Delta infection, or what we call breakthrough infection, can still spread the virus to others, but appear to be infectious for only a shorter period of time. Mas maikli na makakahawa ka pag bakunado ka. Okay? So that's the advantage of getting the vaccine. Pag hindi ka bakunado, exposed ka sa Delta variant, mataas ang risk mo na less than 3 months, pwede ka uli makakuha ng Delta variant. So the risk of reinfection at least 180 days after the first infection is also higher in the Delta variant. Okay, so I'll end my talk here. What are the takeaways? We know that the COVID-19 has mutated, and this has produced what we call the variants of concern. And this is now the emerging threat in the control of the pandemic. With vaccines, hopefully, we can control the transmission. Current vaccines are still effective in protecting us against hospitalization and death, which is a very more important clinical endpoint. Even if we get the infection, our risk of hospitalization and death is still very high. And on that note, we should be receiving vaccine. We continue to be receiving vaccine. The other point here is that as long as people are not fully vaccinated, more people are still roaming around without vaccine, carrying the virus, potentially infecting other people. Then the other aspect of preventing transmission is wearing the face mask, the non-pharmaceutical interventions. Face mask, face shield, physical distance, and good ventilation of your workplace or home. So vaccination is the best protection against Delta. Please get vaccinated. Thank you very much for your kind attention.
Thank you very much, Dr. Solante. Thank you very much for that insightful discussion. Very, very clear po talaga ang pag-differentiate nyo ng Delta variants from the other variants, especially in terms of benefit of early testing, transmissibility, and effect of vaccines. Galing po. Thank you, Doc. To moderate our open forum, may we call my co-host, our Chapter Public Relations Officer, Dr. Margo Venus Dasalia Ku. Dr. Ku, take it away.
Thank you, Dr. Kapihang. Hello, good evening, Dr. Solante. Are we ready for our open forum?
Yes, Margo.
Okay, thank you so much. Okay, I'm going to start with a question that is malapit po sa amin na sa trabaho po, no? With the rise of the cases due to variants, would you recommend the use of a CLIA test to assess for viral load or antigen test for patients that are still RTPCR positive? Dalawa po ito. Is RTPCR still recommended to ensure that the patient is not infected anymore prior to return to work? Kasi may nakikita po kaming mga company na instead of the RTPCR test, pinapakuha po yung ECLIA test kasi yung sa vaccine, and they would like to know kung nakataas na yung mga antibody titers po nila.
Okay, first I would like to comment no yung infectiousness ng virus no. Sa ngayon kasi hindi ang ginagamit na natin is the time based no. From the time na onset of illness and then you count 14 days mild to moderate. Then on the 14th day talagang hindi na siya infectious. You don't need to repeat the RTPCR. Remember your RTPCR will be positive up to 3 months no. So pag nag-positive ka, baka naman hindi mo siya papasukin ng 3 months, no? Sayang naman yun. Just have to observe. Kung wala naman siyang symptom, no? And then, naka-recovered na siya, fully recovered na siya. Can still go back, no? Can go back to work as long as na kompleto na niya yung 14-day isolation, no? Okay, now, I would like to comment on the antibody, no? Neutralizing antibody, yung mga sinasabi natin na test, no? Kailangan yung tingnan kung ano yung antibody na dinidetect doon sa mga test kit na yan. No? There are two antibodies. One, the anti-nucleocapsid antibody and the anti-spike protein antibody. So, pag yung kit na yan contain the anti-nucleocapsid antibody, that means pag nag-positive ka niyan, you have exposure. So, ibig sabihin, that antibody means you have been previously exposed and you have recovered. Pag meron kang spike protein antibody, that's another story because it can be induced or most likely it can be induced by vaccine. Okay? So, pwedeng nagpabakuna ka, you develop an antibody, that is the spike protein antibody. Ang tanong lang, kung nag-positive ka sa spike protein antibody, will that antibody tells you you are protected? No, because as of now, wala tayong level of antibody that will tell us na itong level na to, you can be protected. No? May mga pasyente tayo na nabakunahan na, sabi nila, mataas yung anti-spike protein na antibody nila, pero still got COVID. No? So, dapat hindi tayo hihinto doon. Maski sasabihin mo pang meron kang spike protein antibody, magsusuot pa rin ng mask, mag-iingat pa rin. The other part there is the antigen test. No? The antigen test is a very good test. Okay, and in fact, as long as your antigen test is FDA approved, what's the value of an antigen test now? The threshold of detection of antigen test is very low. You need a high viral load. Okay, so ibig sabihin, kung halimbawa antigen test gamitin nyo for screening, pag walang sintomas, mababa ang sensitivity. Okay? But pag nag-positive ka na wala kang sintomas, most likely you have the infection. Okay? But we don't use it to screen sa mga workplace kasi kadalasan naman dyan wala mga sintomas no? So that will not add value. You'll just be spending a lot without adding a layer of protection getting the antigen test. Ang pinaka-importante pa rin sa mga company is really the health screening, no? Yung tatanungin mo sila, wala sila mga sintomas, you have to monitor them. Kaya napaka-importante ngayon na when you ask employees, dapat they should not deny, no? Kasi the only way na hinto natin ito is a lot of this will deny na meron silang sintomas tapos pumapasok pa rin, no? So you have to be very particular with that. I hope I have answered the question of that doctor.
Yes, doctor, very loud and very clear, no? So, pinakamahalaga is the health screening at this time na talagang dapat ng ating mga pasyente and workers ay kailangan honest sila sa kanilang mga health declarations. Yan po. The second question is, with the emerging cases of Delta variant, is more than 15 minutes exposure still relevant?
That's why, no? I should say, kailangan pa rin natin ang ganong klaseng criteria, no? Kasi in general, lahat naman, the longer the interaction, the higher is the risk. Hindi natin sinasabi na lower than that, hindi ka mahawa, no? Pero that's still part of the criteria. So halimbawa, meron kang kausap ngayon, in an enclosed space sa office, no, or sa ano, and then turn out to be positive. So magko-contact trace ka. Sino dito sa mga empleyado ang nakasalamuha ng index case na to? So pag sinasabi mong 15 minutes interaction, dapat kasama yan. But ang ginagawa na lang natin ngayon, as long as you have interaction, whether it's 15 minutes or more or less, you have that interaction, you're at risk, especially if you're not wearing the face mask, you're not practicing the physical distance, and you are in a space or in a room that with a very poor ventilation.
Okay. Doctor, you already said the ventilation part. What can you say about the ventilation devices na ginagamit nila sa mga enclosed space? Sometimes yun na lang ang ginagamit din nila as a protection para sa ganun daw, pwede pa rin magkaroon ng certain face-to-face meeting. Parang ganun po.
Alam mo, Margo, no, that's something na we need to correct, no? Kasi yung mga purifier, ano pa ba yung mga ginagamit dyan? Mga ionizer, that's just an adjunct, no? I mean, when you are in that room, you still have to wear the face mask, no? Mas importante pa rin yun. That can help, okay? Siguro, it can help, no? Pero, wag kang kampante. Pag nandun ka na sa office, may ionizer dito, may purifier, pwede na ako magtanggal ng mask. That's not a good idea. You conduct the meeting, you have to have the physical distance, you should still be wearing the face mask.
Thank you for answering that question. This is something for the booster and vaccine. With the ongoing mutations of COVID virus, how many doses of a booster kaya po ang magkakaroon?
Ang sa mga pag-aaral ngayon, no, sa mga preprint data, no, 6 months to 8 months after, ang ganda ng antibody response with the third dose, okay? Especially for those Sinovac, no, dalawang Sinovac, may mga data na nang binigyan ng Pfizer or Astra, ang taas, okay? Tapos may data na nung binigyan din ng third dose ng Sinovac, mataas din, pero ang pinakamataas talaga na nagbo-boost ng immunity are the mRNA and the virus vector vaccines over that of a third dose of Sinovac, okay? So kung kailangan man natin ng booster, may mga factor tayong kailangan intindihin din, no? Kung may booster, ano ba ang available na ibibigay? Okay? Kung may booster, kaya ba ng gobyerno bibili ng pang-booster? Kasi kung walang mga bakuna pa na allocated for booster, mas importante pa rin na kailangan mabakunahan mo ng lahat bago ka mag-booster, no? But there are takeaways in that, Margo, no? Like what's happening now in the healthcare facility ng mga nabakunahan ng Sinovac? Marami-rami na rin ang nakakasakit, no? Sasabihin natin, bakunado yan, nakakasakit pa rin ng COVID. Mabuti, mild lang. But when you have healthcare workers taking care of COVID patients, magka-infection ng mild, tapos they will be isolated for 14 days, that will be disrupting the function of the health facility kasi ma-isolate mo sila, konti na lang magtatrabaho. And then, ang iniisip ng mga healthcare worker, nagka-infection pala yun, fully vaccinated, ayaw ko nang magtrabaho, ayaw ko mo nang mag-report, nakakatakot. I mean, that's my point, no? So that's where most of us believe we need boosters specifically for healthcare workers.
I see. So again, with regards to booster, is it okay to have a different brand from the initial doses? Kaibang brand po ang gagamitin. May study na po ba nung ganun, Doc?
Yes, meron na mga data on that, no? Kagaya ng sinabi ko kanina, merong data na dalawang Sinovac tapos nabigyan ng Pfizer or Moderna, dalawang Sinovac nabigyan ng Astra, no? Or dalawang Sinovac nabigyan ng third dose ng Sinovac.
Okay, thank you for that information, Doctor. What is the future of COVID-19 vaccines? Do we do this kaya every year, ang booster po? Kaya ang plans nito?
ang hirap sagutin, no? Ayaw kong sumagot ng baka mali yung masagot ko. ito lang yung ano ko thoughts, no? Kung halimbawa ang problema natin yung Delta variant ngayon, we need to eradicate the Delta variant. Hindi natin palaguin pa. Kasi pag lumalago pa na tumataas pa ang mga kaso ng Delta variant, chances are within that variant another mutation. Pwedeng mag-mutate uli yan, no? Na which can also be resistant to the vaccine. So dapat ano ang paigtingin natin ngayon? Sana mabakunahan lahat because that's the only way. That's the only way to prevent mutation. That's the only way to protect us from transmission. Sana isuot natin yung face mask at face shield araw-araw because that's directly protecting us against getting the Delta variant. Those are the two important points. Pag nakita natin next year na hindi pa rin tayo bakunado, konti pa rin ang bakuna, projection is really there will be more mutations. Ang kawawa dito yung mga third world countries because our access sa mga bakuna talagang limitado kumpara sa mga mayayamang bansa.
Totoo naman po yun, Doctor. Ito po ay medyo technical, Doc. Is it safe to say that Tcell will be our hope in the event that neutralizing antibody is no longer detectable in lab tests?
Correct. No? Kaya nga pinakita ko kanina, Margo, no? Na halimbawa, bumababa yung neutralizing antibody mo, makakuha ka na ng COVID, but still your T-cell is there to protect you against severe disease. So ganun ka-importante ang T-cell sa role ng bakuna.
Alright. Ito naman po, how do the Philippine Genome Center conduct biosurveillance for the variants? Do they rerun the samples from the confirmed COVID positive cases using NGS?
Yes, unang-una walang criteria, no? So they randomly, so lahat ng mga pinapadala sa kanila from different hospitals in different regions, they randomly select specimens and then test. Based on, ang criteria niyan, dapat yung specimen mo, mataas ang viral load, no? So ibig sabihin, mababa ang cycle threshold. So it's random testing and that's why we don't know what's the criteria for them to do the random testing. Kaya nakikita natin ngayon na kung merong report on genomic report, kalat yan, no? Manila, Visayas, Mindanao.
Marerecommend nyo pa rin po ba na ikrian na po ang 14-day quarantine period in the light of the emergence of these variants?
Hanggang ngayon, no, we will maintain the 14-day quarantine, the 14-day isolation for those who have symptoms or those who are exposed, quarantine. Pero merong advantage kung bakunado ka. So if you remain asymptomatic and you are fully vaccinated, meron kaming ginagawa nga na you can be quarantined only for 10 days. Kasi alam natin pag bakunado ka, mas mabilis bumaba ang viral load. And if you don't have symptoms on the 10th day, chances are you will never have the symptoms after 10 days.
How about yung may mga symptoms po, Doctor? 10 days isolation pa rin tayo, right?
Yes, ang symptoms kasi, that's the most important indicator. So, halimbawa, 10th day ka, tapos may symptom ka pa, ay huwag mong palabasin kasi may symptoms ka pa. Oo, ganun lang kasi. Ano kasi dyan, it's either the number of days or if there is or the patient is already asymptomatic for 48 hours. No?
Okay.
Wala nang lagnat, no? Ang lagnat kasi ang pinaka-importante diyan eh. Walang lagnat. Yung mga pahingal-hingal, yung mga naka-recover, matagal yan, no? May mga humihingal pa diyan after 1 month, 2 months. So hindi yan basihan, no? Ang pinaka-importante diyan yung lagnat, no? Bumababa na rin yung pag-uubo, no? So yun ang importante.
So bali, Doctor, 2 days na lang po ba ang yung walang symptoms po ang oobserbahan from the time siya na-isolates? Ganun po ba? Hindi na po ba 3 days?
Hindi. So halimbawa, na-isolate mo siya, no? So you have to complete 14, no? So ang ano namin yan is 14 plus 2 or 3. So
Okay.
that's 17.
Thank you for that clarification, Doc. Ngayon, another ano po sa ating mga manggagawa. In an offshore installation, how do we monitor properly the new consignors for presence of COVID-19 using rapid antigen test? Do we need to a separate mess hall hours for them? Do we restrict them from using the sauna and gym while still under observation since day one when they arrive in the installation? Parang ganun po.
Oo, kailangan pareho yan sa ginagawa natin dito. Pag galing ka ng abroad, galing ka ng ibang bansa, you have to institute 14-day quarantine, 10 days doon sa quarantine facility, and then 4 days doon sa bahay. No? Ganun pa rin yan ang mangyayari niyan. You will do the test on the 5th to 7th day. Even if negative, kailangan nyo pa rin siyang i-isolate and complete 14 days, especially with the Delta variant.
Okay. Doc, when does the day one of quarantine really starts?
The start of the quarantine usually starts from the time you have the test positive. So, ganun ang ano. For those symptomatic, you can start them at the onset of symptoms.
Okay.
So, kung halimbawa, ngayon nag-umpisa ang sintomas, then you count 14 days.
Okay. Thank you so much for answering those. Meron pa tayong mga ibang question. Pagpili lang po ako dito sa ating audience. Ang daming tanong. Very interesting po itong ating webinar tonight, Dr. Solante. So, ito po, is it safe to get the flu or pneumonia vaccine within 2 weeks after the final dose of COVID vaccine? I think safe naman po yun, no, Doctor?
Yeah, actually, walang day na required niya, no? If you completed the second dose, you can get the flu, pneumonia on 24 hours after getting the second dose. Ang ginagawa namin yan, para lang hindi magkaipon-ipon ang mga adverse event, no? Kasi pag nagka-flu ka, vaccine, masakit din ang braso mo. Bibigyan ka niyo pneumococcal vaccine, sasakit din ang braso mo, no? Baka magpatong-patong yan, dapat hindi naman ka-report yan sa mga trabaho, no? So, ang ginagawa namin, ang advice ko sa mga doctor, sa mga pasyente ko, pag natapos ka na ng COVID-19 vaccine mo, pahinga ka muna, 1 week after, bibigyan na kita ng flu or pneumococcal vaccine.
Okay, thank you so much for answering that. At least malinaw po. Ngayon po, what about yung mga close contact pero wala po silang symptoms? They need to quarantine or isolate. Can you comment on that?
Yes, they have, no? So the close contact are the ones that should be quarantined, no? Napaka-importante ng quarantine dahil if you let them go out and even if they don't have the symptoms, hindi natin alam eh. So ang maganda dyan, if you have close contact of a known confirmed COVID, you isolate them, you quarantine them, no? And then, pag ang mga contact mo, mga matanda, may mga diabetes, may mga comorbidities, i-test mo sila on the 5th or 7th day from the onset of the last contact, from the last contact of that confirmed case. Bilang ka lang ng 5 to 7 days. Pag mga bata naman yan, usually, ang importante lang dyan, makulong, no? Makulong, ma-quarantine pala, hindi makulong.
Kaya tuloy sila ng stigma, Doc, kasi feeling nila makulong sila. Can you also comment, sir, last 2 questions po. Can you comment about the vaccine for children right now? Ano kaya, ano po ang vaccine on roll sa mga bata?
Yeah, magandang pag-usapan yan, no? Kasi alam mo, ang mga bata ngayon, marami na rin na-admit na sa mga hospital, no? Sa mga na-approve ng bakuna, 2 lang ang pwede sa bata, but not the less than 12 years old, Ito yung 12 years old pataas, no? So, the Pfizer and Moderna. Now, ang aprobado na yan ng Philippine FDA natin, no? Ang problema lang, kulang-kulang pa tayo sa mga bakuna. Kaya ang stand ng Philippine Pediatric Societies, ganun pa rin man nga, risk pa rin ang bata. Kailangan lang na protektado ang mga bata by giving vaccine sa mga adult na kasama ng bata para hindi magkakasakit yung adult at mahawaan ng bata.
Okay, thank you, Doctor. In the interest of time, ayaw naman namin kunin ang buong oras niyo, Doc. Saan po kaya kayo pwedeng masulatan pa sa mga aming mga concern, Doctor, no, with regards to the topic at hand?
Margo, ang gagawin niyo na lang, no? I think Cess has my email. You
Okay,
can email me the other questions that na hindi natin na-tackle, and then I will answer those questions through email.
Thank you so much. Maraming salamat, Dr. Solante, sa maganda ninyong mga topic or mga sagot po sa mga maiinit na tanong na ito. No? Meron pa nga po tanong sana tungkol sa huling tanong ko, yung sa face shield. No? May mga ano kasi na gusto na sana nilang alisin ng face shield, pero nasagot na natin yan na kailangan talaga na face mask and face shield on. Di po ba, Dr. Solante?
Very important, no? Because the face shield is an added layer, no? Ganun pa man na sa ibang bansa, wala daw, no? Sa akin, pabayaan mo na yung ibang bansa. Basta sa atin, medyo mas mataas yung protection with the face shield. Hindi ako naniwala talaga na napaka-importante ng face shield. Ang face shield kasi, ang ginagawa kasi ng mga data on that sa mga healthcare facility, no? Kasi pag harap mo ng COVID, no? Pero when you are also in the community, hindi mo naman alam kung sino ba yung mga may COVID doon, nakaharap mo. And that's an added layer of protection.
Totoo po yun, Doctor. Now, to award you, Doctor, with our appreciation, may I call on my dear colleague, our PCOM QC Chapter Secretary, Dr. Jose Angelo Taylor.
Thank you, Dr. Ku. Dr. Solante, thank you very much on behalf of the Quezon City Chapter, PCOM Quezon City Chapter. We would like to present you this certificate of appreciation, and it reads, Philippine College of Occupational Medicine, Quezon City Chapter, presents this certificate of appreciation to Dr. Rontgene M. Solante for serving as our resource speaker of the chapter's 32nd Kapihang OH COVID-19 Strikes Back, the rise of the Delta and Lambda Variants, given on this 8th day of September 2021, Quezon City, Metro Manila, Philippines. Signed, Dr. Jose Angelo Taylor, Chapter Secretary. Signed, Dr. Catherine S. Artaiz-Carriaga, Chapter President. Thank you so much, Dr. Solante, for this wonderful presentation. Back to you, Dr. Aku, and thank you very much.
Thank you so much, Dr. Angela Taylor. Now back to you, Dr. Kabingon. Thank you so much, Dr. Solante.
Maraming salamat po ulit, Dr. Solante. No? Actually, I am still at awe on how you presented your lecture, how you answered the questions, and gave your practical advice. Thank you also, Dr. Ku, for moderating the open forum. At this point, I would like to thank our PCOM QCC Virtual Kapihang team. Pinangungunahan po ng aming technical head, our very own PCOM QC Chapter Secretary, Dr. Jose Angelo Taylor. Thank you, Dr. Taylor. This webinar will also not be possible without our PCOM QCC CME team na pinangungunahan naman po ni Dr. Maria Cecilia Diana. Thank you very much as well. To formally end tonight's educational activity, ladies and gentlemen, our chapter vice president, Dr. Jeremias M. Florante.
Thank you, Drs. Ku and Kabigon. Can you hear me?
Yes, no, we can hear you.
Yes, Doctor, loud and clear.
Thank you. Hindi ko lang buksan yung camera kasi baka mag-statue dance ako.
No problem, Doc.
The rise of the newer variants of SARS-CoV-2 virus poses further challenges not only to the safety and health of our workers, but to the productivity of the companies and the nation. Hence, information dissemination like this is very essential so companies can strengthen current policies and programs aimed at preventing and controlling COVID-19 in the workplace. The Quezon City chapter of the Philippine College of Occupational Medicine is grateful to Dr. Rontgene Solante of San Lazaro Hospital for the time and knowledge shared to us tonight. We would like to thank our partners who have been with us since the start of this Kapihang OH, the OSH practitioners and consultants, safety officers, company physicians and nurses, HR personnel, and all OSH advocates. Special mention also to all our incumbent national officers and members of the board of directors, past national presidents, our very own chapter officers and members of the board of directors, and the general membership of the Philippine College of Occupational Medicine for the usual support and cooperation to all our undertakings. Thank you as well to the men and women behind our regular Kapihang OH. Further, I would like to invite everyone to the premiere screening of our 31st Kapihang OH entitled Addressing Mental Health Issues in the Workplace in our official YouTube channel. So please do not forget to like, share, subscribe, and click the notification button of our YouTube page. Do not forget to like and share also our official social media accounts in Twitter, Instagram, and Facebook. For additional questions to our resource person tonight, or if you have suggestions for a new topic to be discussed in our next Kapihan, or you wish to partner with us, please do not hesitate to send us an email at PCOM Quezon City Chapter @gmail.com. Again, thank you very much. Always remember that in Quezon City Chapter of PCOM, we always value your safety and health. #PCOM QCC Cares. Ingat.
Thank you, Dr. Torrante. Again, I would like to invite everyone to like our official Facebook page, follow our Twitter and Instagram accounts. And again, please support PCOM QC's newest project, the OSH to Go video series, by visiting our official YouTube channel and watch the first video of the series. No, it will just take 6 minutes of your time. And don't forget to like, share, subscribe, and hit the notification button. Muli, maraming salamat sa inyong pagdalo sa susunod na 33rd Kapihang OH. Ako po, si Dr. Jason Cabigon, na parating nagpapaalala na sa Quezon City Chapter, ang inyong kaligtasan at kalusugan ay mahalaga. #PCOM QCC Cares. Good night everyone and stay safe and healthy.